Okay. Hi, I am here to discuss what a mini mental state examination is. It's also known as the MMSE. This is an 11-question evaluation that doctors or health professionals use to evaluate clients and populations who experience confusion. This could be due to an illness. This could be due to dementia. This could also be used on populations who have experienced head trauma and actually experience confusion, as well as any geriatric population. The MMSE checks for short-term memory, language skills, orientation to time and place, the ability to understand and follow directions, and spatial abilities. So some of the questions on this exam could look like, what is the year, the season, month, naming 3 things and then the remembering those 3 things, spelling words, copying shapes, and repeating and listening to phrases. The MMSE is scored by based off of the orientation, the registration, the attention and calculation, recall, language, and praxis based on from what the patient provides you with their points. So they have a maximum score of what they could get on the question, and then the patient score, and then those will be calculated at the bottom. And then it'll show you on the back the information underneath those subcategories for orientation, registration, and so on. And then it's also, when you get those results, you have a chart that goes by method, score, and interpretation. So it has single cutoff, range, education, severity, and then it has each score. So it goes from 0 to 24, or 0 to 30, but when you get your score, if you're higher than a 20 or less than a 24, you're abnormal, and all the way up to like 0 to 17, severe cognitive impairment, 18 to 23, mild cognitive impairment, 24 to 30, no cognitive impairment. And again, underneath each method is the result of what the patient would be, the interpretation, basically. So some limitations to the test would be, it would be that sometimes the score doesn't necessarily mean that you have a cognitive impairment, and it doesn't necessarily mean that, like, a low score doesn't mean that you would have dementia. Sometimes, like, certain abilities can affect your score based on, like, your language, physical disabilities, education, or cultural aspects could inhibit you from achieving a higher score. If you're asked to repeat something on the test, it's probably just to look for changes in your in one's cognition. So a deterioration in your score might prompt your doctor or the healthcare provider to ask questions once again, just to make sure that there's no changes and we're asking the correct things and you're hearing what we're explaining. Bye.